The streets of New Orleans are empty. One of the most vibrant cities in America is on lockdown. Louisiana remains one of the states hardest hit by the coronavirus. Over 13,000 people have tested positive and hundreds have died.
I never felt like that in my life. And that's what made me know something was not right with me. It was the pressure and the breathing. Oh God, that was the worst.
In early March, Aquanetta Robinson Demery had a headache, and then the fever came. She was tested for COVID-19, and 5 days later, it came back positive.
Oh boy.
Demery is a nurse who at the time was working at a New Orleans assisted living home, and today is still feeling the effects of the virus.
Like a film. Every time I blink my eyes, it feels like something passes over my eyes and come back down, like a film is in my eyes. About 4 days after I really got sick, I lost the ability to smell. That's not back yet. I lost the ability to taste. That's not back yet. My bones, my knees, my ankles, my back, my neck, it was hurting me so bad. It was just hurting a lot, just pain and weakness, physical weakness in my legs and in my arms.
Aquanetta's primary doctor, William LaCourte, is a veteran from the front lines of Hurricane Katrina's aftermath and is prescribing a mix of medicine, one of them being hydroxychloroquine, which is the chemical name for Plaquenil, a drug that President Trump is routinely talking about.
We are using Plaquenil and azithromycin, which I believe is really working. And the people I talk to believe it's really working, even though it's not been proven by double-blind controlled studies. As the president points out, we really don't have time for that stuff to come in. And based on the response of the people that are getting it, I think it's the appropriate way to go, and it's helping us.
Meanwhile, Governor Edwards has extended his stay-at-home shelter-in-place until April 30th. And now you can see here in the French Quarter all these businesses that are shuttered, not open. People are losing money. Unemployment numbers are through the roof. And the National Guard are trying to get PPEs to hospitals and health workers by dropping off thousands of gloves, gowns, and masks.
The hospitals in New Orleans are stressed. The governor says that ventilators will run out soon, and the convention center has been fitted as an overflow for hospitals if they run out of beds.
Frankly, it's embarrassing that our organizations like the CDC are telling us that we may need to use scarves and handkerchiefs in our jobs to take care of ourselves.
Like many nurses in New Orleans, Amy Devine has been working through the maze of keeping safe amid a lack of personal protection equipment.
But we shouldn't be having such shortages. But for the richest country in the world, I'm really upset that I might have to wear a scarf to work to take care of patients and have to reuse my gowns and hunt for disinfectant wipes and potentially, infect my family when I come home.
Another major issue in New Orleans is protecting the elderly or compromised. Health officials say that cases of the coronavirus disease have been reported in over 60 of Louisiana's 436 nursing homes. This assisted living administrator and nurse wants to stay anonymous and does not want to name her facility.
Right now we have 28 residents that are positive for COVID. We have 7 in the hospital and 2 just died.
According to this administrator, there are decisions being made at some of the hospitals that she believes are unethical.
Somebody had went bad one day, and we sent it to the hospital. She has a DNR, and the hospital doctor wanted to just send her back, didn't want to treat her, said, well, you have COVID, you probably have COVID-19, you're not going to survive this, so we're going to send you back. And DNR does not mean do not treat. They were not going to treat this lady at all.
After a series of hard discussions between the nursing home and hospital, the decision to admit the patient was made. But
they did withdraw all care, and she's going to die at the hospital. I think they do look at them and say, well, she's old. She doesn't, you know. Let's save it. They really are doing that though.
The front line of this virus is not only deadly, but deceptive. New Orleans continues its social distancing. Essential workers in the healthcare industry are trying to maneuver and cope, while the general public wonders when all of this will end.
I'm gonna fight this, and even if it takes me to do some extra breaths and stuff like that to get through talking real good with somebody, I'm gonna still fight this and suck in as much oxygen as I can to make my lungs feel like they're working again. They don't feel the same anymore though.